Welcome everyone to today's episode of GLI Live. My name is Donna Cryer. I am your host. I also have the privilege of being the founder and CEO of the Global Liver Institute. We started GLI Live at the beginning of the spring in early March to provide information and connection to liver patients, people who are immunocompromised, cancer patients, but it's grown into so much more. We have so appreciated everyone's feedback on how the expert guests that we have provided, the conversations and connections have helped everybody not just survive during these difficult times, but to thrive. And hopefully today will just build on that record. I am overjoyed to have with us today two of our Global Liver Institute interns. And so, we have been just blessed with the experience and expertise and fresh perspectives and knowledge of all of those who have participated in our internship program. And so when we considered the idea of, what did it mean to reopen schools? An idea came forth from one of our interns, where an increasing number of our great ideas come from within the organization, which excites me, to focus on college and COVID. So this GLI Live episode is on college and COVID-19. I want to thank certainly all of our sponsors for making this possible, but I really want to thank all of our interns who contributed questions to this, and then particularly to our guests today, Ian Malloy and Marnie O'Connor. Welcome to the show.
Thank you.
So, Ian, I'll start with you. Where are you physically in the world, and where are you in your educational journey?
So I am currently on campus at George Washington University, and I will be a junior starting next week.
Fantastic. Marnie?
I am also in DC, but I am not living on campus, but I also attend George Washington University, and I will be a junior starting next week as well.
Exciting. It's amazing because we have worked together for months now, and we're in the same city, but we've never actually met. So I do look forward to that someday. As just to set context for those of you who are watching and following these issues and trying to make decisions yourself for children going back or potentially going back to elementary schools, to middle and high schools. We'll focus on college and universities today, but we know that across the country, and this episode will be a little more US based, we know that there are really important examples, successes and setbacks of how other countries throughout the world have been trying to reopen their schools and their various levels of education, depending on how they have experienced the COVID-19 pandemic. But here in the United States, we have had an administration that has laid down the challenge to reopen. We've also had many medical societies, the American Academy of Pediatrics, who have said that having children, particularly young children, back in school in that social environment is very important for their development. We also know that there are a lot of services such as school lunches and other services that are part of the school experience that are very important to young people and to families. We also recognize that until we solve the going back to school problem, we can't solve the going back to work problem. So perhaps in future episodes, we'll explore that. But today we're going to talk about colleges and universities, which have a great diversity of approaches to reopening. Some are completely online, some are trying some type of hybrid with options for students to be online or on campus, and some have, purchase miles of plexiglass and thermometers and other measures to really try to have provide everyone with an on-campus experience. And we're seeing successes and failures because it's been very hard for young people coming from all across the country, all around the world, into this environment. And so we're seeing hotspots and clusters, but we hope to see some successes as well, because the campus experience is so important. So, maybe Marnie, I'll start with you. How has your college experience been so far? What did your university, communicate to you in preparing for this?
Yeah, definitely. So I'm a double major in public health and dance, which are two very different learning experiences, even in person. And so I never had much concern for my public health major, all of the lectures and everything, professors being pretty diligent about giving instructions step by step about how Zoom calls will work, or if it's recorded lectures that they share with us a day, and they say, you have to watch it by a certain date. Whereas dancing for me has been a lot harder, I think, for all of us to wrap our heads around, simply because we all had to kind of take a moment and almost grieve the experience as dancers, because our show was canceled I think it was 2 weeks before the show, and I was stage managing that show. And the day before we were told to leave campus, I was holding a meeting with the whole cast, and I said, we kind of have to go full steam ahead as if it's going to happen, even though it really might not. And so there's a bit of that sadness, I think, more in my dance life at GW, because we wonder if we'll ever be able to be in the same space again while we're all still in undergrad. But I think the professors are supporting us just as much as the students are supporting each other, for sure.
That's wonderful. So Ian, what has your experience been, and how did your university, same university, so how do they communicate to you, because you're in a different programs, and so what has your experience been like?
Yeah, so I'm public health and business, so a little bit similar, but I think probably the biggest one was athletics. I think being told, a lot of us were under the impression that athletes could stay on campus. And then I think we all realized, like, no, this is a serious thing. Like, we're all going home. And I think that was pretty difficult for a lot of just the athletic department as a whole to hear. And I think it was definitely when I think it all hit us when spring sports were canceled. So when we realized that this really wasn't just a vacation or like a little bit of a break from school. And we really started to plan things that we could do at home to stay in shape. That was a whole another journey too, but it was pretty good. I mean, the public health professors are fantastic at GW, and nothing but great things to say about them. And yeah.
That's fantastic. So, it's really been a 3-part challenge so far. Not to make it too survivorish, but so there was the first announcement about in spring and moving off campus or classes converting, and then there was this wonderful summer with GLI and fantastic. And now there is the considerations of how to restart with, I think, different expectations. I think all of us had hoped that we would get a handle on this during the summer, and so classes could resume as normal in the fall. But as that became increasingly infeasible, you are dealing with this experience now. So how are your fellow students dealing with this? What is it like to even walk around campus? Is it, you know, are people keeping socially distant? Are they wearing masks? How are people navigating on campus, Marnie?
Yeah, I live off campus now, and so I actually haven't been on GW's campus in a very long time now. But from what I see, and obviously social media plays a huge role in all of this and how we're all still connected. But I think people have decided to come back to the city and live off campus with friends and things like that. And so in a social kind of private setting, gatherings are happening. I'm not partaking in gatherings like that, which is definitely, it's socially difficult because you have a huge part of college is your friends and being able to say, I miss you, but I really don't want to come over. And I really don't want to see you because I've decided that I don't want COVID. And it's
Public health training comes in handy, right?
Yes, it's in the forefront of, I'm sure Ian understands, it's in the forefront of our heads all the time about this being a in real time case study for a public health crisis and understanding what your role is in that. But I do think there are small things that we can be doing, like mask wearing and socially distant. That is it's not too much to ask, but I don't see it all the time, if I'm being honest.
You know, I have admired Speaker Pelosi's mask game. You know, it matches, they're color coordinated, the game is tight. And so I have tried, excuse me, not COVID. I have the privilege actually of, well, it's because I have had several medical procedures during the course of the pandemic, I have been tested for COVID 5 times. So I know that cough is, and I haven't been anywhere really but here and the doctor's office. So, you know, don't worry about the cough. But yes, I have. So now it has become my sort of minor obsession to build my mask collection. So those rare times when I do go out, I get really excited. I'm like, ooh, which mask am I going to wear? And so I hope that, and I know a lot of fashion brands are doing different types of masks, and Ian, I ordered or pre-ordered the Under Armour sort of masks that supposedly help you, be breathable and exercise, with it. So I know some different other sports brands are making masks for athletes and things like that. So I'm hoping that, mask wearing will become, cool in some way, or at least acceptable and not stigmatized, and certainly not a political statement. But maybe that can be part of a public health social messaging program. How do we make mask wearing in the United States cool?
GLI masks.
We can make GLI masks. We could do that. We could do that. You can be our spokesmodels. And so, do you feel that the value of your education, I mean, you are on campus, but it is altered. And as we think about, I have paid GW, tuition for one of our kids. So I know the cost. What do you have to say about the value of what you are receiving in this sort of altered, I won't even say limited, but altered environment?
I mean, I think all GW students would appreciate some sort of reduction in tuition. I think it is pretty hard to have to pay the bill when you have to learn from home and don't get the full GW experience. I mean, I'm fortunate enough to be on campus, but I know that we had a whole huge financial aid issue where a lot of students were like at a scare, like not even being able to afford to come here anymore. And that was really hard to listen to my friends go through that, because it's a pandemic. Like the last thing they want to be worrying about is all of a sudden they're losing $50,000 in financial aid. And it's just, so I do think that public health, it's a lot more engaging in this sense, just being in a pandemic, being able to hear from public health experts about their experience in the field and how they're involved in what's going on. But I mean, I think depending on what you're studying, I think the experience is very different.
How is it in your business classes? Are the economics of a pandemic part of the class?
It's interesting. I mean, I think it's a little bit, it's not really, it's just like regular old classes. We haven't really talked about the COVID implications, but I haven't really taken a class that I guess goes into that sort of business.
You know, I interact with a lot of different, you know, universities and alumni, and your point about, you know, financial aid, you know, first there was with the, you know, shift to moving people off campus so quickly in the spring, there was a call to a lot of, you know, alumni in, you know, college, you know, proximity to just house people who all of a sudden didn't have access to their dorms. And then there have been, you know, different campaigns and fundraising to make up for gaps in financial aid, or, you know, in some universities with large endowments, pressure from alumni to use those endowments at this time. You know, what are they for, if not for such times as these, to make up the gaps for, you know, for students whose, you know, parents may have lost a job or experienced some, you know, big financial shift and crisis. Not only parents or grandparents or aunts and uncles or whoever's helping to pay, you know, tuition or support in some way. And so I think that needs to be, you know, recognized. And I'm seeing that play out not just in conversations with alumni, but even in how the voting is going for some, you know, boards of trustees and overseers and things, to make sure that we're investing in students and students' ability to still receive a high quality education at our various institutions during this, and that, you know, disparities in education aren't compounded by this crisis, you know, particularly for a lot of kids who are first generation to college and may not have that network or resiliency. You know, we don't want to see people, you know, taking a step back. You know, one other thing though that's interesting to report is that some of the graduate schools, you know, have seen a drop, and so, you know, might be the time to apply to graduate schools, you know, now, particularly if you're, you know, mid-career or employed or something and want to do it online, or as they're transitioning to online and not have to travel to the campus. You know, there's perhaps that advantage to it. So, you know, Marnie, you have a lot of friends who are, you know, in different types of educational environments. And so, you know, I know from a lot of, you know, med students who are sort of all of a sudden drafted into COVID service, and their education sort of accelerated, but you have experience with friends and experiencing other types of trainings and certifications. Can you tell us about that?
Yeah, sure. I received my EMT training in the fall of 2019, yes. And that introduced me to a whole network of people who work in that profession. And I know a lot of students from back home where I'm from in Cambridge, Massachusetts, who were in the middle of their EMT training, and the National Registry for EMTs fast-tracked their certifications to get them working right away. And I think it goes to show that, you know, there are so many students in this country that don't do the 4-year college experience, but in a time like this, when COVID put the whole world into a constant state of emergency, how important that student experience is, and how being, you know, whether you're in technical school or you're an EMT or you're training to be a paramedic, you're still a student, and there's still a safety net there of being able to say, I'm still learning, I'm not there yet. But now, because of COVID, they were pulled into the workforce in a way that they weren't expecting to yet. And that completely takes away that safety net. They're now working professionals in a very intense time. And I think about them a lot because that's just as much a student experience as mine is, even though I go to a 4-year higher ed institution. And there's something to be said for the resilience of students who are going through that experience, and just how important it is to really be supportive of your peers and your professors alike at this time, because everyone's adapting and everybody was pulled into a situation that we weren't ready for.
Absolutely. And we've, reset our understanding or our appreciation for who is an essential worker. And so certainly those who, can't shelter in place at home and do their jobs via computer, there's this sort of double risk and double challenge, one of being exposed to the coronavirus, to the novel coronavirus, and then also to be out practicing, a trade or a profession, when, you should still have sort of the training wheels on or have a lot of supervision. I remember when our older daughter is a doctor of veterinary medicine, and her first internships and even early in her fellowships and things, she really valued being in a practice that had a lot of support and people she could ask questions to and goes, because as many of the procedures were, new for the first time. And so I think that's just as true for an electrician or a plumber or an ENT as it is for, for a vet. Ian, what are some of your other friends experiencing who may be in different majors or at different colleges?
Yeah, so a lot of my friends are athletes, and a huge thing that's been happening is a lot of programs are being cut. And I have a friend at Iowa who's they cut the swim team there, and I also had another teammate who was committed to swim at Iowa, and they cut the program. And then even at GW, we lost seven programs. We've had to cut down just because it's too expensive. And I think it's just the reality is, like, I'm a swimmer. Swimming and dive is not really a very monetary, we're not bringing in a lot of money. So there's always that fear. I mean, we've lost 7 Division I programs in the swimming community. And it's just, I mean, it's probably going to keep going as like football. A lot of, you never really realize how important football or these basketball is to keeping sports alive. And if those seasons don't happen, the harsh reality is that athletic departments aren't going to be able to afford to sponsor as many programs as they do. So it's been hard hearing friends whose programs have been cut this year, and this being their last year, being able to compete for their school, and watching them go through the difficult process of having to find either another school or having to give up their dream or whatever that might be. So I think athletics it's been hard. I think especially coming back to campus, there's only been 4 approved teams allowed on campus. And so swim and dive was not one of them. So it's hard to have our team separated when we're supposed to be swimming at our championship in February, but we won't have our team together until January. So it's hard to navigate that. I'm sure it's hard for the coaches, but it's hard not to see your teammates and then with a rally for a championship, hope maybe in February.
Wow. So there's a lot of layers to what you said. I would think that the routine of practice and training, so much a part of who you are, and as well as how you're experiencing college, and then being part of a team is something. My father played college sports and actually went into minor leagues in a semi-pro career, and and coached and ended up coaching sports even while he was teaching afterwards. And so the team is so important. And then for Division I programs, not being able to compete can affect your your career and your life trajectory for years to come. So I do hope that we take this. We do hear about football and basketball, and I think you're right about how they support other programs, but there's a great Harvard Business Review article, I believe, about the value in corporate America of people who have played team sports, and the different types of sports that correlated to various jobs, like water polo players being really great at teamwork because of how they had to pass the ball around and things like that. and swimmers being really great at jobs that required focus. Because, at the end of the day, it's, you and your lane. And so I think that we need to appreciate what athletics and being part of a team adds to a person, adds to the educational experience, and adds to, the lifetime of value. And we talk about that in our incentive of, getting college right during this pandemic, and the urgency around bringing all of our attention and investment to it. So that's what I'll say to the country and to the administrators. We need to do better by our students and the areas around you. What would you say to your fellow students, Ian? What would you want them to do and to know while we're working this out?
Say hang in there. Say it can get really lonely, but make sure you're reaching out to friends that you haven't seen in a while. A call doesn't hurt anyone. Stay on top of classes. I think Zoom is going to be hard for schoolwork, but just find a place that's not your dorm room or your bedroom at home. Just stay on track of things and try to find a hobby. Get outside. I think that's also really important. I know, like, getting outside, the sunlight, just getting into new environments. But yeah.
Is it hard in a city campus? It's not like you have acres and acres of things. You step a block away and you're, on Pennsylvania Avenue.
Yeah, DC is not too pretty out right now. It's a little bit sticky, so not really enjoying the heat and the mosquitoes. But yeah.
So, Marnie, what would you tell your fellow students? What would you want them to do and to know?
Definitely. My biggest tip that has helped me is keep your Monday through Friday, and keep your Saturday and Sunday, because throughout all of this, I have still felt a bit of thank God it's Friday by Friday, and I'm very grateful for that. So figuring out a way to not have the days blend into each other, calling your loved ones, like Ian said, being honest about, like, I need to call my mom. I miss my mom, and I'm living on campus or in DC, and it's not the same, and being honest about what you really need to stay happy. So, yeah.
I think that's good advice for everyone. So thank you both for that. Yes, I did walk my dogs earlier this morning so that before it got super hot and sticky crazy. And I do call my mom more. I'm interested, we were talking in some of the pre-show things about making jokes about, TikTok, and and maybe Marnie, as a dancer, you do have your TikTok account. We won't expose it.
Oh, I'm not.
Platforms to people. What are you using? So you mentioned, Zoom, Ian, but what are you using to connect with each other? Is it all text, WhatsApp, what?
Like Snapchat, probably. Twitter is always fun. Instagram, not really as much, but I think TikTok's fun just to, like, make a funny video with your friends, or like do a duet kind of thing where it's just a joke and stuff. But I think Snapchat and like FaceTime has been really nice. There's also like Netflix Party, which has been a lot of fun to watch a Netflix show virtually with your friends and get to like chat about it. So
my friends can't agree on a movie. They wanted to use the Netflix Party, but we're in this endless text loop about how can we agree on a movie, and then we start talking about something else. But thank you for reminding me about that. That's a goal for when I do realize that it's Friday. I feel sort of like I think I used it as my out of office message over the weekend. I felt like the Dowager Countess. What's a weekend? As time sort of blends on the 54th day of Octobuary here that we are. But I want to thank you so much for participating in this. I want to thank all the interns for contributing to this idea of this and the questions for this. I hope I did you justice. You're always going to be part of the GLI family. So I look forward to seeing, what you're going to do next with your education and your careers. And I hope you always include us. But I thank you for lending your expertise to this episode today.
Thank you so
Thank
much.
you so much. Thank you.
And thank you everybody for watching. Join us next time. We're going to bring you more fun topics, more conversations, more connection. You'll find additional information on reopening schools of various levels in the show notes and on the globalliver.org website, on our our Twitter account, our Instagram page, maybe on TikTok. I don't know. Look, keep track of us. But we'll certainly be back here on Facebook. And we thank you so much for joining us today.